Morning. So I just want to thank everybody for being here this morning, and I want to thank Dr. O'Connor and Mercy Medical Center and St. Joseph's Hospital for bringing us this amazing program. Dr. O'Connor is a board certified colon and rectal surgeon out of Mercy and St. Joseph's, and we are very honored and lucky to have her here with us this morning. So, Dr. O'Connor, I'm going to hand the floor over to you.
Okay, and good morning to you as well. Thank you very much for inviting me today. I am very excited to talk about this because there is no question we are in strange times. And our world has not been the same for quite some time. I think we're going on at least 8 months at this point right now, from the building intensity of this pandemic. And situations like this can cause significant stress in our lives. So, what we're going to discuss today is really what is stress, the effects of stress on the body, what is self care, and its effect on our mental and physical health. And we're also going to discuss the importance of self care, how to institute self care, and some of the key components of self care and combating stress because they're interchangeable. And we're going to focus on sleep, we're going to focus on nutrition, exercise, and screening. So, this is when you think about stress, this is the picture that and the image most people think about. And these are the terms that we commonly use. I'm so stressed out. So and so stressed me. Fill in the blank, so on and so on. We are inundated with stress in our daily lives, and you just feel like a frazzle ball. So stress really is that feeling of an emotional and physical tension, and you're tight, and it comes from an event that makes us feel angry, frustrated, or nervous. And it's your body's reaction to a challenge or a demand. The effects of stress can really influence the course of many conditions, including psychological and mental health problems such as depression, anxiety. And with what's going on today, there is no shortage of stress, there's no shortage of depression, and there's really no shortage of anxiety. But stress really is important. There is a benefit of stress. It's actually a normal part of our lives. We're hardwired for stress since the beginning of time, and it actually helps protect us. When we were running from those saber-toothed tigers, we needed to know there's something wrong, and we needed to be able to mount a stress response to deal with that stress. And if you remember way back, that robot show where they would go danger, danger, danger. Stress is our body's warning system. We need this response. It's a normal part of our body, and it helps to protect us. So when we feel stressed, we have that flight or fight response. So what happens is our brain perceives chemicals, and these chemicals are like epinephrine, norepinephrine, and cortisol. And these are released as a result of our stress response. And you may feel sometimes when you're stressed, you get that increase in heart rate, your blood pressure goes up. You know your body is tense and you're feeling stressed. And partly what happens during this response is you get more oxygen and more glucose delivered to the muscles. And you need that oxygen and you need that glucose to either face your enemy and fight or either run and flight. So your body is preparing you to deal with the stress response. Also, what happens is your immune system's activated because when you're in a stress situation, you don't have time to be sick. You don't have time to be ill. You need your immune system to get in gear and help you. And your breathing is increased. So sometimes when you're stressed, I can't deal with it. That's your breathing increased because you need that response to deal with what's coming towards you. And your heart is in overdrive. It's just beating away. The other thing we find when we're stressed is we get razor sharp focus. You need to see that saber-toothed tiger coming from you, and you need to know where to go to get away. where to go to hide. So that focus helps us hone in on what's causing us stress, and it helps us avoid that stressful situation, and it helps us get to safety. So we need this stress response. It's a normal part of our lives. And you know, short-term stress, it's good stress. Stresses are good. You know, stress can be positive in a way that it can motivate you to perform on tests. I know a lot of people, especially my niece, when it's like the last day or two, last couple of hours, she kicks into gear, she studies, and she does so well. And sometimes people wait until the last minute, and it increases productivity at work because you are focused on that task. I got to get it done. I'm under the gun, and you start to be more productive. Stress can also push you to your fullest potential. It can help you reach your goals. When you know you've got a deadline and you know you've got something to do, we kind of get in gear, we get focused, and we do it. And sometimes when we're under stress, it can help you accomplish tasks more efficiently. I personally don't like stress. So I do my things way ahead of time so I don't have that energy. But some people, it helps. And stress can also boost your memory because you know you're getting that razor focus. And there's some stresses that are positive, like an upcoming wedding, the birth of a new baby, a new promotion, and the holidays. They're right around the corner. I know for some that can be debatable. You might not like your in-laws, but stress can be good. And stress, and these stresses that are good are normally short-term stressors. And the benefits of stress, good stress. It helps fortify the immune system that we talked about. It improves how your heart works, it's beating, you're getting that oxygen, that blood flow, and it protects your body from infection because that immune response is boosted. And it helps to improve your concentration, it helps to improve your functioning at work because you're focused. So stress, if we look at it in its proper terms and its proper condition, can be good stress. And there are benefits of stress. So you're asking me, Dr. O'Connor, if there's good stress, why does stress get a bad rap? And if you're my patient, you know I preach to you over and over and over moderation. Moderation in life is key. So we're not running from saber-toothed tigers anymore, but we have modern world threats that are now causing stress. Getting in that day-to-day traffic jam. You know, if you leave the house 5 minutes late and you've got somewhere to go, you're going to be in traffic. You got to get there. You're now stressed. This global pandemic, I can't even begin to tell you how many of my patients, myself, are stressed as a result of what's going on in the world. Relationship issues are a key source of stress. We've seen the uptick in racial injustice and social strife. That's also another form of stress. And the more exposure we have to these stressors, the more intense our frequent and physiological reactions become until we find ourselves being constantly on edge. The body's stress response is not designed to be constantly activated. We are not supposed to stay in that level of stress. We don't sustain stress. Our bodies are not meant to sustain that constant level of stress. And if you look around you, a lot of the issues that we have been sustained for months and months and months. And we're dealing with that stress for quite some time. So this is a little bit of a busy slide, but it drives the point home. The first picture, right over here, this is a picture of your brain on stress. It's a normal brain on stress. So this is a normal, healthy response to stress. So we perceive a stress response that triggers the hypothalamus in the brain to release corticotropin-releasing hormone. And instead signals to the pituitary gland, which is also in the brain, to secrete a hormone called ACTH, and that's adrenocorticotropic hormone. That then stimulates the adrenal glands, and those are small little glands that sit on top of our kidneys to produce cortisol. And I know we probably all heard about that hormone cortisol. And that enables our body to maintain steady supplies of blood sugar. So we have that energy to cope with the prolonged stressor. And it also stimulates the production of adrenaline. We've all heard about adrenaline. We get that adrenaline rush. So we get cortisol production, we get adrenaline production, and that gets our body ready to respond to whatever stress it is. And that we're ready, we've got the blood sugar up, we have our energy, we have our adrenaline, so our blood's pumping, and we're ready to respond to that stress, whether we're gonna fight or we're gonna leave. Fight or flight, that's our stress response. And these hormones, they increase our blood pressure, they increase our pulse, we start sweating, and it also decreases our digestion. Because if we're stressed, we need the blood in our body to go to the muscles so we can run. We don't need the blood going to our belly so it digests food. And it also fuels our immune system like we talked about. And when the stress is over, the body returns to normal. But if you look at the middle picture, this is continued stress. And now you see chronic and high cortisol release. So in prolonged states of chronic stress, these effects don't go away. And then when you look on the third picture, that's when the body's no longer responding properly to being able to deal with these high levels of hormones. And that is when we get the negative effects of stress on our body. So we have good stress, short term. And now we go to bad stress. And that's when it's prolonged. And that's when these hormones are kicking in overdrive. And that means our blood pressure stays up. Those cortisol levels stay up. Our heart rate stays up. And those are the negative effects of stress on our body because it stays up. So now as a result of having prolonged stress, we get the negative effect. So our immune system is now weakened. Our blood pressure is now high. And we find ourselves just fatigued. We just can't deal with another day. We can't deal with another problem. We just are emotionally and physically fatigued. I don't know how many of you have probably turned off the TV because you just can't take it anymore. I don't know how many of you have just signed out, reserved, just checked out because you're just fatigued. You're emotionally fatigued. You're mentally fatigued. And then what that brings on is depression because you get to a point where you're just so stressed. You're so fatigued. You're so worn out. You feel as if you can do nothing. And then the anxiety builds up because of that depression, that fatigue. And then what do we get? Heart disease. So these are a lot of the side effects of stress that we have to deal with on a long-term basis. And I don't know about you, we're going into November, and that's a heck of a long-term basis. So how do you know when enough is enough? I mean, we all deal with stress differently. It may take you more to get to a point of fatigue than the next person. So how do you know? Some of the signs that you can think about when you're wondering, is enough enough? Your inability to concentrate or complete tasks. If it takes you twice as long to read that page, to complete that task, to get your goals accomplished, you're not concentrating. You're not focused. If you find that you're getting sick more often, you have more colds, more sniffles, you're just not feeling well, or some of the other illnesses that you had in control are now flaring up. Headaches, those tension headaches, that is really a very, very clear sign of enough stress. And irritability. I mean, some of us are naturally irritable, but if you're living with someone who's a little bit more irritable, that can be stress. That stress, it depletes your ability to deal with situations and circumstances because you are fatigued. So you will be a lot more irritable. And you'll have trouble falling asleep or staying awake because you're not getting sleep. And a lot of people come to my office and they say, Dr. O'Connor, I'm just not eating right. I just don't feel good. My stomach's, bloated. That's change in appetite. And if you get that change in appetite, it can lead to other issues and digestive issues that are coming to my attention. So when I talk to my patients, it's just not surface level. It's like, what else is going on in your life? Because there are so many things that affect our body. Stress is one of them, and affects our appetite. And you'll also find that people are more angry or quick tempered than usual. They're just more quick to snap at you. They're more quick to bite at you. That's when you know you're getting stressed, and enough is enough. And this stress has significant effects on our body. It can produce long-term illness. It can produce depression, diabetes with that cortisol level up, the blood sugar up, cardiovascular problems, because you remember when we're stressed, our heart rates increase, our blood pressures increase. We're in that constant ready state. And then digestive problems. When you're stressed, you're not eating right. If you're not eating right, you may overindulge. And then you're eating foods that just are not digested properly. You're getting gas, you're getting bloating, you're uncomfortable, you're getting constipation. And then that leads to straining and so many other problems. So there are a significant amount of effects on our body. And if you start to feel these and you start to realize this, that's when you may start thinking, you know what? Enough is enough. When you look at stress in America, there was a survey in 2019 pre-pandemic, and the sources of stress in the survey in 2019 pre-pandemic money was 75%, work was 70%, the economy was 67%, relationships were 58%, family health was 53%, personal health, paralleled family health, that was 53%. Job stability was 49%, housing was 49%, and personal safety was 32%. This is pre-pandemic. So you can imagine after pandemic. 55% of Americans are stressed during the day. Over half of America is stressed during the day. And according to Gallup's 2019 poll, the emotional stress, over half of America is increasing. It's 20% higher than the world average of 35%. So the world is stressed at 35%. America is stressed at 55%. And if you think about it, if you don't have work and you're worried about you're not bringing in money, and if the economy is not functioning, you don't have a job, you can't bring in money, that's going to affect your relationship. You may not be able to have health insurance. So your family's health is now affected, your own personal health, and you're worried about a job stability. You don't have the money, you don't have the income. Are we going to lose our house? Then you have no home. If there's no home, where is the personal safety? So if these are pre-pandemic levels, you can imagine where we are at the pandemic now. The American Psychological Association says more than 8 in 10 Americans say the future, that's 83% of Americans say the future of our nation is a significant source of stress. I mean, just look around you. The previous high was in 2018, where it was 69%. So that's a significant increase in the amount of people who say of the future of a nation is a significant source of stress. And according to Arthur C. Evans, he says, he quotes, we're experiencing the collision of three national crises: the COVID-19 pandemic, economic turmoil, and recent traumatic events related to systemic racism. So as a result, the collective mental health of American public has endured one devastating blow after another, and which the long-term effects of many people are going to struggle for years to come. So when is it too much? When do you wave the red flag and say, help me? For those who do not adapt and form coping mechanisms, the impact of prolonged stress on health and well-being can build up and have lifelong, significant negative health effects. So how do you cope? All right. You need to understand how you stress and why you stress. Find ways to manage that stress. You take care of yourself. Reach out for support. Obviously when the stress is a short-term stress, The effects are short term. But when the stress is prolonged, out of your control, and the future is uncertain, how do you cope? I mean, if you really honestly think about it, when you don't know when and if you're going to go back to work, when you'll get a paycheck, when you'll find a job, how are you going to care for your children? How will you pay your bills? How will you keep your business afloat? When will you see your grandchildren? When will you take a vacation? How can you combat longstanding systemic racism? How do you cope? What do you do? You've lost a loved one. You're now alone. There are so many issues that are going on. We need to learn how to cope. So, in order to effectively manage negative emotions and feelings of stress, you first need to have a clear understanding of your own stress. Understand how your body responds to stress. So when you're stressed, start thinking about what you're feeling. And, understanding how your body responds to stress can be key in managing those stressful situations. And it reduces the impact that that stress has on your health. Stress affects everyone differently, and it can be caused by different factors, different triggering events for each individual. Once you have identified what causes your stress, you can begin to recognize how your body is going to respond to those stressful events. And it also allows you how to react and why, and make you understand why you're reacting this way. So one of the things I like to talk about is self-care. We've heard it talked about left and right, self-care, self-care, self-care. What really is self-care? It's the practice of taking action to preserve one's own health. It's the practice of taking an active role in protecting one's own health and well-being and happiness, particularly during periods of stress. I just want to say that again. It's the practice of taking an active role in protecting one's own well-being and happiness, particularly during periods of stress. So self-care, I always say, is not selfish. Why do we do it, and why do we need it? I'm going to give you a quick story, I know in the interest of time. When I was on the plane with my daughter, I'm one of those mama bears. I always had this plan in my head that I would put my daughter's mask on first rather than mine, because I thought it was very selfish for me to put my mask on first when my daughter's here. She can't protect herself. I'm her mother. I need to protect her. So on one of my umpteen plane rides with my daughter, I stopped the flight attendant. So let me ask you a question. I'm a mom. Why would I put my mask on first and not put my daughter's mask on? And she said, ma'am, if something happened to you, how would you be able to protect her? Light bulb moment. And I realized it's very important. And I always think of that when you think of self-care. Self-care means that you're being mindful of your own needs. So you're better able to support the people you care about. When you take care of yourself and you're not stressed, you're better able to meet the needs of others. You can't give to others what you don't have for yourself. If your well is dry, if your well is empty, you can't give. Self-care is not selfish. It's quite the contrary. So how does self-care benefit you? Self-care can boost your physical health. It can improve your mental health. It can make you a better caregiver. It provides a break from all the stress that we're under. And it offers time alone to just stop, reflect, and relax. And it generates soothed feelings. We're all less able to handle the stresses that come our way when we're depleted by physical and emotional exhaustion. But we're more resilient and we're more able to handle life stresses when we're feeling our best, both physically, mentally, and emotionally. So some examples of self-care. First and foremost, plan and schedule, block this time out. I used to think that was a crop. However, being chief of 2 hospitals, owning my own practice, a busy mom, and volunteering, I find my time is shrinking, 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 shrinking. So you really do have to actually plan time for yourself. You have to prioritize yourself. You're just as important as that meeting. So plan and schedule the time. Block it out. You can take a bath, pamper yourself, do your hair, do your nails, your own facial. I know sometimes, especially during this time frame, we don't want to go out. So have a pamper day in your own home. Meditate. Just take some time, and you don't have to light candles and sit in the cross-legged position. Just sit at your desk, sit at your table, just meditate. Read a book, read something that you've always wanted to read that you didn't get any time to read, and spend some time outside. Find a green place. It makes a big difference. The other day I went bike riding for about half an hour and I felt so reinvigorated. And reach out to family and friends. That is so key. I know we're socially isolated. I know that we're not able to get out and see, but there's Zoom, there's video chat, there's Facebook. Reach out. Don't stay by yourself. And if you really have no idea where to start with self-care, if you're just so depressed, so full of anxiety, and just so fatigued and exhausted, Maslow's hierarchy of needs is a place where you can start. So Julia Coer, she's a licensed medical social worker. She was doing an interview for Women's Day, and she started suggesting Maslow's hierarchy of needs. It's a proposed theory by Maslow to just start making sure your basic needs are met. So if you don't know where to start with self-care, start with the basics. Your physical needs. Are you eating and drinking enough? Simply that. Are you nourishing your body properly? Think of your safety needs. What options are available to increase housing and financial security if you don't feel financially secure or you're not happy where you live? Love and belonging. Who can you reach out to for a connection? Is it your spouse, your family members, a friend, a colleague? There's got to be somebody in your sphere, in your circle that you can reach out to and get that connection. And also building self-esteem. Spend time doing something that makes you feel masterful, that makes you feel good. Whatever it is, whether it's painting, gardening, do something that you love that makes you feel good about you. And also something we really don't do is self-actualization. Spend time evaluating your goals, your values, and whatever steps you need to do to make sure you get closer to them. And that'll give you a path toward your journey of self-care. So in the interest of time, I'm going to focus on just the 4 key components of self-care and coping with stress. And these are all the ones I completely believe in. Exercise, nutrition, sleep, and comprehensive care. Self-care comes in many shapes and sizes. What re-energizes you. It reinvigorates you. It refreshes and renews you. So exercise, working out regularly is one of the best ways to relax your body and relax your mind. Aim for just simply 30 minutes a day of moderate intense activity. And that's a brisk walk. And you can easily just go outside. It costs no money. Just go out, walk every day for at least 30 minutes. If you want something a little more intense, you 75 minutes of either vigorous swimming, jogging, something that works for you. And set goals. Set goals to keep you motivated. If you're going to go around the block once today, make it twice tomorrow. Or if you do 1 mile this week, do another mile the next week. So these goals can keep you motivated. And just understand, any amount of exercise is better than none. Even if you break it up into simple 10-minute increments. You can do a burst of 10 minutes of exercise here and 10 minutes of exercise, an hour or two later, or 10 minutes of exercise later in the evening. It adds up. So it doesn't have to be 30 minutes, 75 minutes set in the gym. Any amount of exercise you do works. And speak it into your day. Take the stairs instead of the elevator. Park your car farther away from where you're going to go, whether it's the store. Lunchtime, get out of the office, get out of the building, get out of the cubicle and walk. Keep weights in your drawer, and you can do a full set while you're on a Zoom call. Get a partner, make it fun. There's so many things that you can do to exercise. And the benefits of exercise are enormous. Along with weight control and diet, exercise plays a key role in controlling your weight and preventing obesity. It reduces the risk of heart disease. Exercise strengthens the heart, improves circulation. It increases your blood flow. It raises the oxygen levels, all the things that good stress does. It lowers your risk of high cholesterol, coronary artery disease, and heart attack. So those are all the things that you're combating when you exercise. You're that stress response, you're combating that stress response. And regular exercise lowers your blood pressure, it lowers your triglycerides, and it gives you more of a cardiovascular benefit. Also, some researchers have shown that some cancers, such as colon, breast, lung, and uterine, are reduced with exercising. And there is also some research that shows people who have had colon cancer that has not metastasized, meaning spread to the rest of the body, exercise can reduce the recurrence. So just when you think we're done, there's more. Exercise improves your mental health and mood. I mean, how many times have you just felt bad, but you've gone for a walk and you feel a little bit better? And also, when we start to get older, it reduces our risk of fall due to improvement in our balance and strength training. And it can help you sleep. Exercise helps you fall asleep faster and stay asleep longer. Just make sure you're not exercising right before bedtime. And a really good benefit of exercise, it improves your sexual health. It may lower the risk of erectile dysfunction in men, and in women, it can increase arousal. Exercise increases the chances of living longer. It may reduce the risk of dying from leading causes of death, like cancer and heart disease. But before you start any exercise program, make sure you see your doctor. The next big thing is stress and diet have always been linked. It's possible that someone eating a healthy diet and a balanced diet may feel far less stressed than someone eating a poor diet. If you're feeling overly stressed, your digestive system is probably under attack. So you probably, want to make sure that you change your diet so you feel more physically fit and more emotionally fit. So diets should contain fruits, vegetables, grains, lean proteins. And a proper diet can really counterbalance the effects of stress. It can enhance your mood, and it can stabilize your mood, and it also can reduce the blood pressure. As I said before, chronic stress can weaken the immune system and affect the body's defenses, leaving a person more susceptible to infection and disease. You are what you eat. So if you can fortify your body, you're fortifying your soul. So what foods should you eat during stress? I mean, you should eat these foods specifically because they're good. But during stressful times, if you have foods that are high in vitamin C, such as oranges and other citrus fruits, tomatoes, peppers, greens, leafy greens, that can reduce the stress, and it also helps to boost the immune system. Calcium-rich foods, they may reduce the muscle tension and anxiety, because when you're stressed, you get really tense. And some examples of calcium-rich foods are low-fat milk, yogurt, sesame seeds, cheese, broccoli, again, leafy green vegetables. You'll see that's really key. And B vitamins. B vitamins are found in bananas, leafy greens again, nuts, seeds, meat, fish, and dairy products. And these provide the body with energy. And you need that energy boost after a period of stress. Foods to eat again that you can do with magnesium. Magnesium helps you relax muscles, reduce anxiety, and it plays an essential role in hormone energy production. You can find magnesium, particularly in Brazilian nuts. These are high in magnesium, beans, lentils, grains, and leafy greens again. Complex carbohydrates are very key. Eating whole, unprocessed carbohydrates such as whole grain bread, pasta, cereals, oats, and brown rice will help to enhance levels of serotonin. And serotonin is a mood-boosting hormone, and that mood-boosting hormone helps you feel happy and more relaxed. Low levels of serotonin in the body are linked to increased levels of anxiety and depression, as well as poor quality of sleep. So keeping this hormone in balance will help to deal with stress. Additionally, complex carbohydrates are digested more slowly than those refined varieties, which can help stabilize the blood sugars. So again, I cannot emphasize how much we are what we eat. And essential fatty acids are key. Omega-3 and omega-6 are some of these are essential fatty acids. These vital nutrients help the body function effectively, and they're important for proper development and function of the brain and nervous system. It helps regulate blood pressure, a liver function, immune and inflammatory response, and we saw how the immune system is under attack when you're under a lot of stress. It lowers the release of glucocorticoids. That's the hormone released from the adrenal gland under stress conditions. And some sources of essential fatty acids are sardines, salmon, Atlantic mackerel, cod, herring, lake trout. You can even get it from canned like tuna, nuts, pumpkins, flax seeds, kale, collards. There are a whole host of foods that can help you with the omega-3 fatty acids. But just as there are foods that you should eat, there are some foods that you should avoid during stressful times. I'm sure these are the ones that we love the most. Caffeine is key. It acts as a stimulant. It causes the adrenal gland that we learned about earlier to release hormones like cortisol. And we saw the effects of high levels of cortisol. And that's already high due to the fact that our bodies are under strain and stress already. It reduces our ability to deal with stress. I know when you have people drink a lot of caffeine, they're not able to sleep, so they get insomnia. There's nervousness, and that's inherently linked to stress. And it can interfere with the absorption of magnesium, which we just learned a minute ago is needed for energy production. And it can interfere with the absorption of vitamin D that's needed for metabolism boosting. Foods high in fat and sugar, so they really are horrible for us. They're good, but that we like to eat them, but they're not good for our bodies. According to a study published in the British Journal of Psychiatry, high consumption of processed fats increase the risk of depression. Researchers found that people with diets high on processed fats had a 58% higher risk of depression than those who ate foods that were whole. When you have cravings for processed and sugary foods, it usually increases during times of stress. We want that comfort food. We want that ice cream. We want that mac and cheese. We want the carbs and the bread. But the thing is, these sugary foods provide a short, quick burst of energy, and we get those temporary feelings of stress relief. But then you crash right back down and get a low period where your blood sugar levels are low. And then you start getting irritable, and you have that craving for that terrible food, which is increased. You want more food that's high in sugar and fat. So it's a roller coaster ride. Processed foods often contain high levels of hydrogenated or oxidized fat, and that can block the production of essential fatty acids. And we just learned again about the effects of essential fatty acids. I don't need to go into too much about alcohol. We are self-medicating, and we are doing it in a very bad way. Many people turn to alcohol as a means of dealing with stress. The Nielsen report reports alcohol sales in stores were up 54% in late March compared to that same time in March of 2019. Online sales were nearly up 500% in late April, 500%. And according to a Morning Consult poll of 2,200 US adults conducted in early April, 16% of all adults admitted they were drinking more during the pandemic. And they were with high rates, especially among younger adults. 1 in 4 millennials and nearly 1 in 5 Gen Xers had upped their alcohol intake. People are drinking more and more, especially during the day. So you may think alcohol may have an instant calming effect on your body, but long-term usage increases the amount of stress in people's lives because one drink leads to a second drink, which leads to a third drink because you keep chasing that calming effect, and that can lead to addiction. Excessive alcohol intake can lead to sleep problems, nervousness, and skin irritation. And it causes the body to release larger amounts of adrenaline, that hormone we talked about. It also affects the blood sugar level. So you want to limit your alcohol intake to 1 glass of wine or a cocktail for women and 2 for men. Sleep and stress are closely linked cousins. They go together like oil and water. Stress can adversely affect sleep quality and duration, while insufficient sleep can increase our stress levels. According to the National Sleep Foundation survey, 43% of people aged 13, as young as 13 to 64, have reported lying awake at night due to stress at least once in the past month. The exact role of sleep is really not clear, but it's necessary for muscle repair, mental tasks, and also for our concentration. Experts recommend that we should aim for at least 7 to 9 hours of sleep a night. The Centers for Disease Control report that 35.2% of adults in the United States are getting less than 7 hours of sleep a night. I'm not going to make everybody raise their hand who's gotten more than 7 hours of sleep last night, because I don't think it's any of us on this call. Do you know what sleep and stress have in common? Studies have shown that sleep deprivation is linked to higher levels of cortisol and more extreme cortisol response in the presence of stress. So according to the CDC, people who get less than 7 hours of sleep we just talked about, they have an increased risk of obesity, heart disease, diabetes, stroke, depression, arthritis, and kidney disease. We may not know the reasons for sleep, but we know that it's important. So some of the tips for a good night's sleep for sleep and stress. Don't eat or drink close to bedtime. You want to make sure that you have at least 3 to 4 hours before eating and drinking before you lay down to go to sleep. That'll also help with some of the issues that reflux people may have. Avoid that alcoholic nightcap. You know, the alcohol, that nightcap that you just kind of desire to take. Avoid it. Don't nap after 3 p.m. because it'll make it more harder for you to fall asleep later that night. Use the bed and bedroom only for sleep and only for sex. Reduce the blue light effect, turning off devices, computers, phones, tablets, and TVs at least an hour before heading to bed so our brains can kind of power down. Increase bright light exposure during the day, which also helps to improve your mood. And get regular exercise, but don't do it between 2 to 3 hours before bed because you'll still be energized. Take care of yourself. That is the last thing, the point that I want to make today. Do not avoid physical health maintenance and care. Many of us have put these visits on hold because of the COVID-19 pandemic. We're not seeing our doctors. We're not doing the screening exams that we need to do. Screening exams such as mammograms, colonoscopy, prostate cancer, pap smears, these save lives. Your annual physical exam with your primary care physician or your family practitioner are key to help diagnose whether there's diabetes or blood pressure and examine the heart. Your dental exams are key, as well as your eye exams. So that is all part of self-care, taking care of yourself and making sure you do the routine physical exams and screening exams. So the summary of the take-home points are: stress is a normal part of our lives. It can be positive, but it can be negative. So know yourself, know your stresses, know when enough is enough. And pay attention to your body. Pay attention to these cues. Practice self-care, eating right, exercising, getting enough sleep, and getting your routine screening and health physical. That's all part of self-care. You have to understand, I don't know how long this pandemic ends. I think one of the participants said, when is it over? We don't know. Hopefully a vaccine is on the horizon. But even so, if it's not COVID-19, there can be another issue, another emergency. You have to learn how to take care of yourself and put yourself first. Please understand, if there's anything you take from this, self-care is not selfish. So practice self-care, eat right, exercise, get enough sleep, and care for yourself with those preventative measures. And if none of this works for you and you still find that you are so depressed, you're just so fatigued, you have so much anxiety, get help. The American Psychiatric Association has a support team, and in the US, the number is 800 374 2721. 800 374 2721. And if you're calling anywhere from outside the United States, it's 202 336 5500. 202 336 5500. And if you have found that you're suffering from substance abuse, you have mental health services, there's a national free helpline. It's confidential. It's open 24 hours a day, 7 days a week, 365 days a year. And they have referral information in Spanish and English. And the number is 1-800-662-HELP, 1-800-662-HELP, or 1-800-662-4357. It was wonderful to be able to speak with you today. Are there any questions? I'd be welcome to open the floor for that. And if you want to reach me, I have offices in right here in Rockville Center at Mercy Medical Center. I'm at the Ryan Building, Suite 407.